Hi, my name is Michelle Hawbaker. I'm a licensed professional counselor supervisor, and I'm a licensed clinical addiction specialist. And I'm going to try and talk to you a little bit tonight about when to get help, and if you do want to get help, how you go about that process. I can't start this conversation without at least reinforcing what Sheila and Dr. Petzing have said in talking about the stigma that's out there. It's very real, and unfortunately, it delays treatment quite often, and mental health issues are just like any other disorder. The earlier you intervene, the better. I hope if you get nothing else from this, from the video, from Sheila, from the numbers that Dr. Petzing gave you, is this is so common. Mental health problems are so common with males, with females, with children. You know, it's an unfortunate that there's a layer of secrecy over it because it is so common and it's a secret that's damaging. You know, it's damaging to our society. So, when do you get help? It can be a really hard thing to figure out. So I'm just going to give you a general rule for when to get help. If there is a symptom that you or your child are experiencing and it is causing them not to be able to function in some way, shape, or form. They're not getting to school on time, you're having trouble getting to work, you're having difficulty accomplishing your daily tasks, and if this problem has persisted for at least 2 weeks, 2 to 4 weeks, it's probably time to go talk to someone about that. That's not normal to not be able to do something that you need to do to get your life done, you know, for 2 to 4 weeks. So it's a good time to go talk to somebody about that. So okay, so you've convinced yourself you need help. Where do you go? It can be a really tough decision to make. It's never a wrong idea to start with your primary care physician. Routinely, when I look at information about what primary care physicians are treating, in the top 10 reasons is always depression and anxiety. It's always there. They treat it routinely. They're usually well versed in the treatment of those disorders. It's not a bad place to start, especially if you have that trusting relationship. Now, locally, if you have insurance, I hate to tell you this, but probably the right thing to do is to turn the card over and call the phone number on the back and ask them who your in-network providers are. And I apologize for telling you should do that at first. If you're computer savvy, you might be able to figure it out on their website. But you know, this treatment, it can be expensive, and you want to go with somebody that you're paying for insurance, and you should go to the person that your insurance is covering. Usually there's a list of options. You go to the website, put in mental health, or call the benefits people and ask them who they cover, and you'll be surprised to know that even though supposedly there was a parity law that passed some time ago in the federal government, that mental health coverage will be different than your physical coverage. There might be a different copay, there might be some limits to the amount you can go. There's differences. You should check that out. That's if you have insurance. Now, if you don't have insurance locally, one of the things that you can do is called Trillium Health Resources. They manage the money that the state provides for people without insurance. And our state provides money for people without insurance, so that's outstanding. You can get mental health treatment if you don't have insurance. You have to go to the provider that's approved. Port Health Services is one of them, and you can go to an unlimited psychiatry visits, and you can go to 24 therapy visits. And if you need more therapy visits, we do have to fill out a piece of paper, but it's okay. It's not that terrible, and we get that done also. Here in Dare County, Port Health is the biggest provider of those services. I believe Integrated Family Services also, but Trillium Health has an exhaustive list of them on their website, or you can call their access line. If you don't have to stay in Dare County if you're uninsured and you want to seek mental health services. You can go to any of the 24 counties in their catchment area. For some reason you don't want to go in your home community. It's an option. What will happen? Generally, you're going to, if you get, you know, I'm biased. I'm a therapist. I'd recommend you start with a licensed therapist. They're well trained to do it. They're going to ask you a ton of questions. They're going to tell you what they think is going on with you and what they think will help. Now, most of the time, the best practice is to do a combination of therapy and possibly medication later if that's not effective. That's common, but they should be able to give you an idea of what they think is going on with you. They should be able to give you an idea of how it would be treated, how long it would take. Now, one thing I would just clearly like to advise is if you go and you talk to any medical professional, but certainly a therapist, if you don't feel comfortable, go find another one. It's fine. It is absolutely okay. At Port Health, I have 10 therapists. Purposefully, we have people with very different personalities, very different, they use different modes of treatment. It's okay. It's okay. Find somebody else, get a recommendation. You're not going to hurt anybody's feelings. It doesn't mean there's something wrong with you. If you don't feel comfortable, you need to be comfortable in that relationship. You can find somebody else. That is for routine situations. I would be remiss if I didn't take a minute at least to talk about emergencies. We are very fortunate in our state to have a service provider for emergency situations. If you ever feel that yourself or somebody that you're concerned with is having feelings of suicide, extreme depression, anger outbursts, talking about hurting someone else, that's not something you can talk to your primary care physician about or wait to call court on Monday morning. That's something that's going to require some immediate attention. Now, fortunately, if there's one thing I could make you do, go to that back table and pick up these cards. There's a service in our county available called Mobile Crisis Team, and it's run through an agency called Integrated Family Services, and I can't speak highly enough about them. They're available 24/7. If you are experiencing or someone you love are experiencing a substance abuse, mental health, or developmental disabilities crisis, pick up the phone, call these people. With your permission, they will come to where you are. They will come to your house. They will come to the 7-Eleven parking lot. They will come to wherever you are to intervene and help figure out what needs to be done in that situation. It's free of charge. It's a free service provided by the state of North Carolina, and they're outstanding individuals. Just to make the statement though, if you are concerned, if you do have somebody in your life that has depression, or you're concerned about a child, is it normal, is it not normal? You can Google the list of potential symptoms, potential signs and symptoms of someone that's contemplating suicide, and there's a boatload of them. From hopelessness, helplessness, giving things away, withdrawing from family or friends. But look, if you have somebody in your life that's depressed and you're concerned about, somebody's going to have to ask the question. Somebody's going to have to reach out to them and say, you look like you're hurting right now. Have you ever thought of taking your own life? Have you ever felt like life is not living? And that's not something that's really comfortable to do for everybody, and that's all right. And if you're in that situation, reach out. Call these people. They'll come to your door, and help you do that. Ask the question. Sometimes you'd be surprised at the answer. You can gain all kinds of information. There are, I think that's it. I think that's what I got. There are resources. I would be happy if you ever get stuck, you're more than happy to call Port Health Services, and we will guide you if you're not appropriate for our care. We have a tremendously talented group of clinicians in this community that we can refer to. But again, you're not alone. Seek help. Ask for some help if you're not sure what to do. There's people here to help you.
Michelle, and you may have said that the mobile crisis line is 24.
It's 24/7, and if we have any business owners here, there are some posters in the back. If there happens to be an employee place or any place or even a public place, you can post that. Please feel free to take one.
Thank you. Thank you, Michelle.